Hello, I am Dr.Priyamvada Shah. I am a senior obstetrician and gynecologist. My special area of interests are high-risk pregnancy, infertility and laparoscopic surgery. I am currently practicing at Cloudnine Hospital, Pimple, Saudagar, Pune. So let's discuss today something about ectopic pregnancy. As the name suggests, the pregnancy is not implanted at its normal place but somewhere else than the normal place. So what is normal place of implantation? It is inside the uterus. So if the pregnancy is implanted outside the uterus, it is called as ectopic pregnancy. Commonest site being the fallopian tubes of the female, which is called as a tubal pregnancy. But ectopic pregnancy could be implanted sometimes in ovary or in the cervical portion or in the isthmic portion of the tube, or sometimes, which is rare, in the abdominal cavity itself. Now with the advent of ultrasound, nowadays we can diagnose this ectopic pregnancy very early as 5 weeks of pregnancy. So once your pregnancy test is confirmed to be positive and you reach an obstetrician often tells you to do an early ultrasound to confirm the position or the location of the gestational sac, and once it is confirmed that it is inside the uterus, we are not much worried. Now if at all the pregnancy is ectopic pregnancy, that is, it is situated in the fallopian tubes and is diagnosed very early, suppose the beta HCG levels are very low, the sac size is very small and the cardiac activity has not started, then we go ahead with certain kind of injections which does not allow this ectopic pregnancy to grow. If the ectopic pregnancy grows inside the tube, there are chances that it will rupture the tube and it will start causing intraperitoneal bleeding, which is a catastrophic event. So in early pregnancy, we do manage it with the help of injections, but it needs a serial follow-up and serial ultrasound. So one has to be really very patient when we are dealing with the ectopic pregnancy in a conservative way. The success of these injections is pretty good. So in 90% cases, if selected correctly, the chances that patient will not need any operative interventions are very high. Now coming back to surgical intervention for the ectopic pregnancy, which remains again a gold standard for the treatment of ectopic pregnancy. Suppose the pregnancy is in fallopian tube and it has already started rupturing and there is some amount of blood into the peritoneal cavity, then we don't have any option other than doing a surgery. These days we do it with the laparoscopy so that the recovery is very quick and the next day patient starts walking and can go home safely. If the intraperitoneal blood loss is more, then we may have to transfuse you some blood products or blood transfusion might be needed. If the pregnancy location is apart from the tube, like for example cervical pregnancies, isthmic pregnancy, ovarian pregnancy, again it is more of challenge because they don't respond very easily and they cause more bleeding. If it is an abdominal pregnancy, it may be diagnosed very late, then sometimes we may have to do laparotomy, that is opening up of the abdomen and removing the pregnancy. So ectopic pregnancy is a very important diagnosis to be made very early so as to prevent the catastrophic event like intraperitoneal bleeding and shock in a pregnant woman. So always consult your obstetrician as soon as your pregnancy test comes positive.